I had a patient with very difficult to treat hypertension.
It's not easy to find specialists in our area or specialists who might provide services to the type of patients that we service.
By the time they got to see the specialist and they came back to us, this is about 3 months of blood pressure that was still uncontrolled.
I was a provider, I would get regular emails from referral coordinators saying, I can't get this patient into orthopedics, it's gonna take 9 months. I had a patient in front of me with a condition that needed care.
Not having timely access to specialists is one of our biggest frustrations as primary care clinicians.
It's caused lags in diagnosis, accurate diagnosis. It's caused delays in treatment and care.
Sometimes the biggest obstacle to good health is access, and access is often determined by the patient's zip code. In fact, very limited or no access to specialty care is one of the leading contributors to healthcare inequality.
For the patients themselves, it's hard for them to physically and financially access the care that they're going to get from these specialists, specifically in places that are rural. Patients may have to travel 200-300 miles just to get in front of a specialist such as myself.
ConferMED is a service that helps primary care providers get advice and guidance from specialists. What we found is that by creating an electronic connection between a primary care provider and a specialist, we often can work digitally back and forth by communicating with specialists.
ConferMED provides the help your patients need. ConferMED is a national network of specialists who can provide eConsults and other telehealth services to providers across the country. With specialty eConsults that are timely, reliable, professional, and affordable.
ConferMED's eConsults have become a game changer for us. I'm able to get an opinion, we like to call that an e-curbside consult, very quickly to help me decide on what I can do for a patient in the short term.
When I'm in clinic and I happen to come across a clinical situation in which I'm needing that extra guidance, I place an order for a referral just as I would any other type of referral and ask my clinical question, and within about 3 days I get a report back from ConferMED that not only answers my question but provides some additional information for the next steps in care for that patient.
Now patients can go to their primary care doc that's in their quote-unquote medical home, but they can also get subspecialized care as well, because I have the opportunity to review imaging studies, imaging reports, all the clinic notes from the doc.
My experience with all of the specialty reports has been very favorable. They've all been very knowledgeable in their response and very descriptive, and it's been helpful for me to be able to manage my patients.
The report comes straight back to me on the clinical record. That is different.
At its core, ConferMED is a tool that helps primary care practices thrive. And primary care providers provide the care that they want to provide to their patients. And it really does that by giving you a specialist in your back pocket to give you advice, guidance, support.
I think the true benefit and value at ConferMED is that they really make specialty care far more equitable than it used to be.
We're incredibly excited to have received funding from the Quest Diagnostics Foundation, which has allowed us to bring all of the services that ConferMED provides to practices in 5 locations across the country, completely free of charge for those practices. The grant is covering the full cost of implementation and integration in 2 years of services for all specialties, adult and pediatrics, and make those services available to all federally qualified health centers in those regions.
ConferMED is an innovative approach to accessing specialty care. It has been extremely beneficial to our patients to getting the answers they need in a very timely fashion.
ConferMED, connecting primary care to the future.